Welcome everybody to our annual conference at Shared Lives Plus. This is the second one that we've held online, and we're joined by around 400 delegates across the 2 days representing shared lives, home share, family by family, and with lots of input from people with lived experience. These have continued to be really difficult times since we met up last. But these are going to be 2 days which are really packed with stories and ideas for what's possible, backed up with lots of practical resources and plans for making change. So we're joined later by the Minister to hear from people who've made really radical choices in their lives to live fuller lives, to help each other through tough times and to share their homes. And we're going to also be hearing how important it is that the people who give so much get the support and breaks that they need in order to continue to do that. It's my last conference after over 11 years with Shared Lives Plus, and at our AGM this afternoon I'll be looking back briefly at the incredible privilege it's been to work with and learn from so many amazing people, and to see how our work and your work has been reaching many more people and changing many lives. We have a public seminar which is sold out, and which will be talking about what we can all do to rebuild communities, which include everyone. And as in everything we do, we're going to be doing everything we can to live our values and to demonstrate the kinds of change we're calling for. So you're going to be hearing from really diverse perspectives. There's going to be a strong thread of lived experience, and we are going to be celebrating all the ways in which our members have tried new things, have brought the shared living message to new people, and have gone way above and beyond the call of duty. And we're going to be celebrating those in our annual Shared Lives Plus Awards. So we're delighted to be starting this event by focusing on equalities. And we're joined by Mike Clark, who is the Equity, Diversity and Inclusion Lead for Macmillan Cancer Support. And Mike is one of the leading voices talking about this subject within the charity sector, not just in his own organisation, but challenging and supporting all charities and their leaders to do more to live our values, to be inclusive of everyone, and to challenge oppression and prejudice. We've already had the benefit of drawing on Mike's expertise and insight as a team and in one of our webinars for Shared Life Scheme Managers. So I'm really delighted, Mike, that you've been able to join us and that you're kicking off our event as the first speaker today. So Mike, over to you.
Oh, thank you so much. Thank you so much. I'm so excited to be with you, Alex, and with your team, and with over 400 over the 2 days. I'm not sure how many are on right now, but I am excited. So my challenge, what have charities and charity leaders learned during the pandemic period around inclusion and equity? I'm just going to use the terms EDI just to save time: equity, diversity and inclusion. So what have they been doing? Lots done, lots more to do. It's been almost 20 months, nearly 2 years, since people across the UK were told that they should limit their non-essential contact with others and stop all unnecessary travel. It was March the 16th, 2020, when people were told to work from home wherever possible, while everyone else was told to avoid pubs, clubs, theatres and other such social venues. And that was all to try to curb the spread of coronavirus, COVID-19. It was a week later, March the 23rd, the UK's first lockdown would begin. Initially from the number of deaths, the pressures on hospitals, the number of hours worked, people's expectations of rising unemployment, furlough schemes. It's been a 20-month period like none other. The UK's failure to do more to stop COVID spreading early in the pandemic was one of the country's worst public health failures. Not Mike saying that, it was a report by MPs that said it. The published report said that the government approach was to try to manage the situation and in effect, achieve herd immunity by infection. That's what the report said. It also said that it led to a delay in introducing the first lockdown, and then it cost thousands of lives. That's what the MP found. It was a 150-page document entitled Coronavirus Lessons Learned to Date. And it came from the Health and Social Care Committee and the Science and Technology Committee and MPs from all parties. It was the MPs that called the pandemic, which has claimed more than 150,000 lives to date in the UK, nearly 5 million worldwide. They termed it the biggest peacetime challenge for a century. There were some early failures, the report suggested, and it was a term that they used that I want to focus on. They said it resulted from apparent groupthink among scientists and ministers. It meant that the UK was not as open to different approaches on earlier lockdowns, border controls and test and trace as it should have been. And that's been my concern. Have charities and charity leaders also been going through apparent groupthink? And have they not been open to the innovative, creative and very necessary different approaches to EDI and learning lessons from the pandemic as they should be? It's almost 2022. There's not really time for any more failings. And so as Alex mentioned, I got to know him via Twitter. It was after I'd been furloughed in the charity sector. It was a move that my then employer realised was a mistake. In fact, it was the employees, my colleagues, who raised the red flags immediately. They realised that I was one of the 25% no longer working, but on furlough. Their EDI manager wasn't around to ensure fairness, respect, dignity, human rights, etc. And so they weren't sure it was going to be factored into some of the decisions for the charity that was facing its biggest peacetime challenge, including funding challenges. I was in my second month on furlough. It was May 22nd, 2020. Kathryn Smith, some of you know her, newly appointed Chief Exec of Social Care Institute for Excellence, otherwise known as SKY. She knew me. And she just attended a conference, and there'd been an EDI session. And the title of the session was The New Normal. And the strapline was, we must develop inclusive capabilities into the core of management and leadership. We must embed inclusive leadership into day-to-day practice, track impact, and ensure accountability at senior level. Kathryn publicly put it out openly on Twitter, and she asked me the question, Mike, this was such a good session. There was such a powerful speaker. I'm frustrated, though, that we all listen and agree and we applaud. But how do we make it a reality across the sector, the charity sector, and not just a great conference session? I responded to Kathryn's tweet with a number of observations, and I tagged in a number of charity sector CEOs that I knew. That quickly grew to well over 60. Some became inactive and silent, so I stopped tagging them and I tagged others, including Alex, because I wanted the proactive ones to be the ones that were sharing what they were doing and listening and learning together. That conversation continues to this very day. And I don't know what the record is for the duration of a single Twitter conversation, but later this month, it will have run for 18 months. I mentioned earlier the date of May the 22nd, 2020, when Kathryn contacted me on Twitter. The murder of George Floyd was May the 25th, just 3 days later. That led to Black Lives Matter marches in the UK, and many of the chief execs and others across the charity sector started paying attention to this Twitter conversation as we coached each other on the best EDI practice to deal with EDI, not just a pandemic, but EDI also in the light of the murder of George Floyd and its impact on those whose skin colour is of a darker complexion than the majority around them. The great thing, in hindsight, was via a multitude of shared practices, shared initiatives and shared successes, those charity leaders were avoiding internal groupthink, and they were better responding to the awful injustices that were being discovered during the pandemic, including the disproportionate number of deaths from COVID-19 by those ethnically diverse peoples with a darker skin complexion. Prior to the pandemic, the charity think tank NBC published a collection of essays and podcasts. It called it Walking the Talk, putting workplace equality, diversity and inclusion into practice. These showed that people felt that the efforts to improve diversity so far to that point had been slow, and they saw it as tokenistic. The head of the policy at NPC said at the time, what we've heard through this work is that in a variety of ways, people feel they've not been listened to. They feel excluded, undervalued, tokenized. And so it was in the light of that enlightened charity leaders like your own, Alex, who was introduced by Kathryn Smith, he started following me too. And he introduced me, as he's mentioned, to some of the team, and you've started to seek out to be proactive, raise personal confidence, and those of the wider leadership team. I noticed that the Twitter conversation became talked about, not just among the CEOs, but I watched as exec directors of charities started following too. But what else was part of that wider EDI context? Well, looking for workplace and volunteer representation numbers to change, that's always going to be slow. But the conversation around EDI was shifting. Prior to the pandemic, there'd been a safeguarding scandal in some of the top charities. There was a birth of Charity So White in 2019. And in 2020, that renewed intensity from the Black Lives Matter protests. And in 2021, EDI has gone from being a nice to have to being recognised as essential. I've witnessed EDI work becoming intentional among those charities that are serious. The scandals forced the charities involved, but also others, to look honestly at where their own lack of diversity may have contributed to the problem. A leader of one of the charities said the harassment scandal was so profoundly rooted in gender and power and the abuse of power that it felt to be quite important we didn't treat this as if it was a workplace behaviour issue without any context. She also wrote, it threw up a number of other issues. The organisation was very white, middle class, graduate, Remain sympathising and London-centric, all of which was affecting the diversity of their thinking and the strength of their decision making. That was internal unconscious groupthink. What I've noticed as a result, particularly in the last year, some charities have created EDI posts at senior management level. And if it's not a post, because some of the smaller charities aren't able to do that, they've created senior EDI accountability within their organisation, specific to look at diversity. My observation is that this is in recognition that despite the fact that EDI has always been important, it wasn't being given enough senior leadership time. So such charities have started training and embedding diversity champions, and they're calling out, for example, unconscious bias, or racist, sexist, transphobic, homophobic practices, particularly around recruitment and HR. Leaders of such charities have been embedding anti-racist objectives into their charity strategic objectives. But it's also caused some to think about how do they avoid groupthink. They might have called it that, but they've been thinking about that. Nothing changes overnight, but some of those charities are now thinking about how do we address blind recruitment. Some of you know, and I'm coming towards an end, some of you know what that is all about. Blind auditions were first introduced to orchestras in the 1970s, when it was recognised that only 5% of the seats on orchestras were occupied by women. To address that, orchestras put candidates behind the screen so that the judging panel, who were typically male, couldn't see the gender of the musician, and so the individuals were selected on the basis of their talent alone. It worked. Within a decade, the proportion of women in those seats on orchestras doubled, and the number of disabled LGBTQ+ and BAME members also grew. What am I saying? I'm saying it takes action, it takes intentionality. And I want to finish by commending yourselves at Shared Life Plus for your commitment to EDI, for your action to EDI, and definitely for your openness and transparency to EDI. Once you yourselves became aware of the awful injustices that many Black, Asian, minority ethnic colleagues were facing, members of the wider community, once it was brought to your attention, you started to do work. That's what charities and charity leaders have been starting to do. You looked within your team, within your members, the shared life carers, within schemes, within home care services, and you've been looking. I can see openly, transparently on your website that you created an equalities group. Some charities haven't done that yet. You did that as long ago as 11 months ago. You've talked about accessibility, language issues. You wanted to reach all parts of the community. You wanted to make sure that you were selling the concept of shared life, addressing the cultural nuances. Some charities are still in internal groupthink. They don't know how to do that. And you were already recognizing there were cultural nuances. You started the conversation to get the carers, get them thinking and talking about equality issues. And what I liked about Shared Lives Plus is whilst race might be one of the priorities, it's not the only priority. You also, as I come to an end, started discussing the thorny issue of collecting data. I've watched as some charities have approached me and they're still burying their heads. They're opting not to collect because they think it's too difficult. But I saw where Alex wrote in one of the Equality Group Network meetings, the record of it. We don't collect the data and information as we would like across the whole shared lives and home share sector. We ask the questions in the annual sector survey, but we don't get much in return. Now, I have a view that people talk, but they need to be doing action. I then saw that you had a survey this year, and in that survey, you started talking about the equalities data. So what I like about what you're doing at Shared Lives Plus and what other exemplars are doing is they recognise when there comes a time for conversation to stop and for actions to start. So I'm going to encourage you as I finish that you're doing some good things. There are some more things you can be doing, but what I like is you said in 11 months ago in that Equalities Network meeting, let's talk about EDI at the next conference. And here you brought me in to talk about it. Let your EDI conversations flow, but not just in your Equality Network meetings. Make sure you've got those safe spaces, and virtual is okay, right across Shared Lives Plus. And avoid the mistake other charities have made where they've still got talking shops. Shared Lives Plus, there comes a time when talking stops and your people see action. I can see on your website it's happening. My observation is exemplars love to actually see continuous improvement. You're on that track, and groupthink, we don't want you to be doing groupthink there. Bring in the diverse voices. You brought me in this morning. Thank you for listening.
Thanks so much, Mike. That was fantastic. Really, really inspiring and thought-provoking. And I'm just very grateful for all of your wisdom and the generosity of your leadership. I love the way that you look beyond your own organisation right across the sector, and you've been a real galvanising force, challenging us, but also giving us some really practical ideas. And we still feel as an organisation we're right at the beginning of this. We've got a very long way to go, but hopefully we can continue to go on that journey with you. And I think that idea of groupthink and is a really useful kind of practical idea about why diversity is not just a principle, it's something that actually makes things better. And I think one of the ways that we sometimes have groupthink as a charity sector is that we think we're the good guys, and we start from that idea that if we're the good guys, we must be doing good things, and sometimes that's we don't notice when we're becoming part of the problem. So huge thanks, Mike, much appreciated. I know we'll want to continue this conversation, and it feels like a really great place to start the conference. And we're now going to be moving on to a panel session where we are hearing from a really diverse group of people who are all involved in shared lives, home share, and family by family. So lots of you already know at least two of those models. Family by family is newer, but shared lives is obviously where people are sharing their home and their family life with somebody who comes to live with them, who needs support, or who comes to visit them regularly after a really rigorous approval and then matching process. Home share usually involves an older person, but could involve anyone who is looking for a bit of companionship and low-level support, who's matched with somebody who's looking for somewhere affordable to live, who moves in and helps out a bit rather than paying rent. And family by family brings together two families with the support of a coach. A family who may have known their own challenges but is now thriving, using their wisdom and their expertise to link up with a family that's currently going through tough times. So we know that we're going to be joined by the minister for this session in a minute, who's just going to be mainly listening to the experiences of the people on the panel. May want to respond at the end of this, but I'm going to move straight into introducing the panel to you, and just starting by asking some of our shared lives people how shared lives makes a difference, and how has shared lives, living in a shared lives household, kept you going through lockdown? And I'm going to go first because I think we've been having some technical difficulties with Debbie and Pat, who we're going to start us off. So we're going to start with Manjeet and Kulvinder and Pia. So do you want to tell us a little bit about shared lives and how that's kept you going through lockdown?
It's been very hard for the last 2 years now, because she's quite vulnerable. So we have to be protecting her with the injections, the COVID injections, and staying at home. So for the last 2 years, we stayed at home, and the placement officer, Annette Reynolds, she helped me out with the PPE and bringing us up, making sure that we had everything prepared for Pia and the safety of her. But Pia has been with us for nearly 15 years now. And as you can see, she's in the wheelchair, 24 hours, just go to bed. But my wife, Kulvinder, she looks after her 24 hours. It's hard work, but it's a lovable job. But it's a caring job.
Thank you. Thanks very much, and thanks for everything you're doing. You're doing an incredible job. It's, as you say, a really challenging role, and it is good to hear that you are getting some of that support that you need. But I can hear that that's not been easy at all, particularly over the last 18 months. So thanks. We'll come back to you in a moment. And we are going to go next to Adrina and Joanna. And would you like to just tell us a little bit about what the last kind of year or two have been like, and the support that you've had in your role from the scheme, from your scheme? So that's Adrina and Joanna, if we're able to get that. There you are. Hi, guys.
Hello, I'm Joanna.
I'm Adrina.
Hi.
I'm a retired nurse. What I was saying is, within the last 2 years with the pandemic, the shared life workers, Joe, Diane, and Mo, has been so helpful because we were home regularly all the time, and they were coming to support us by bringing gloves and apron for us. We call them when we need something, and they were always there to support us.
Yeah. So we had a similar experience to what Manjeet was saying. We are obviously a very high risk household as well, with the ladies who unfortunately are at the centre today, so they couldn't join us. But so we had to be very careful. We all went out together when we had to go to the stores and stuff, but we had to be very careful and ensure that we didn't pick up the virus while we were out. So Shared Lives, our coordinators, Mo and Diane, were really helpful and supportive, in delivering the PPE and just generally checking in on us and making sure that we were okay.
Yeah, thank you. And again, thanks for everything you've been doing during this period. Do you want to just say a little bit about who lives with you in your household?
Yes, we've got Katrina came to us a year just before the lockdown.
So in the February before we went into lockdown. Which was hard as it was, wasn't it? It
was difficult because again, it was a strange house, new house, and just trying to get her comfortable and we were getting to know each other as well. So that was a period of difficulty because and that's where Mo and Diane were so supportive as well. Jessica, we've had for 14 years. So she's been with us for quite a while. So again, she was adjusting with Trina being new at the house. Yeah. But
it was a stressful time for us just because we were all trying to learn to live together. And there was a lot of estrogen and hormones in that. So we were just trying to learn to live together. And then we had the pandemic and lockdown thrown on top of us. So we did find it quite difficult. But it also, in a sense, helped us because we were at home together all the time. So we were able to spend time together and have that get to know each other, didn't we?
We've heard that so much, I think, from members that shared living has been often a really safe place to be. It's been, there's been that kind of companionship, but it's also been tough, particularly as the pandemic has worn on and it's gone from something that felt like a short-term crisis to something that's lasting a lot longer. And that support from schemes makes all the difference. So thank you. I'm going to see now. I think we might be able to hear Debbie and Pat, but not necessarily see them because I know there were. So we've got your photo up, guys. I can see you, but I don't think conference delegates can. But we can hear you. So the question I had for you was, how does Shared Lives make a difference, and how did Shared Lives Care help you through lockdown, and what kept you resilient?
I'm so sorry you can't see us because Pat's really, really does enjoy visuals of seeing herself. But anyway, yes, we do think that Shared Lives makes a huge. Oh, I think we might be seen now.
Yeah, we can see you now. Yes.
You give everyone a wave, Pat. Okay, I think Shared Lives makes a huge positive difference to people's lives, not just the people we support, but I think it makes a huge positive difference to our own lives as well. And Shared Lives is definitely unique in the strength of the bond that it builds, not just between us as a Shared Lives household, but with both our wider families. And I think it's that family support that has really helped us stay resilient through lockdown. We couldn't have done without that, really. Pat is very close to her sister, and it's been obviously incredibly difficult to have contact over COVID and the distance involved. So when we were able to open our homes to other people, we actually had Pat's sister come to stay a couple of times, so that there was quality of contact. You know, we didn't have the quantity because of COVID, but we were able to have quantity. Yes, we're back now, Pat. And other than that, we've been keeping very, very busy. You name it, we've done it. We've been making, baking, creating, tie-dyeing, t-shirt printing, and staying connected with people has been really useful. Pat has a passion for butterflies, and over the summer we were able to grow some little you can see them there, some little butterflies from caterpillars, and then they went on your hand, didn't they, Pat? And then we released them in the garden. So we've tried to do everything just to try and keep our resilience going. That and online shopping, which has been brilliant, but also keeping in touch with people online has really, really helped. FaceTiming, I don't think we'll ever go back to not FaceTiming family and friends, and being online with our scheme for scheme support and training has been really good. So we've learned a lot of new things. It has been tough. We know it's been really, really tough, and that resilience is hard to keep going. But we think we're doing the best we can in the circumstances, aren't we? But yes.
Thanks very much for sharing that. And I can see that the Minister, Gillian Keegan, MP, has joined us. Welcome, Minister. I know you're here just to listen mainly and to hear about the different kinds of support that people have been providing during the pandemic, and we'll obviously give you a chance to respond at the end of this session. So thanks for joining us. So thanks very much. And I'm going to go now to Norman and George, who live in a home share arrangement. So we're moving from shared lives to home share. And Norman and George, do you just want to tell us a little bit about what you enjoy about home share for people that maybe aren't familiar with the model?
Well, I twice married. I've been widowed for 10 years and had a spare bedroom in my flat, and I felt a bit lonely. So I got in touch with, what's the organization called?
Two Generations.
Two Generations, told them what I was looking for. George, meanwhile, got in touch with them, and they married us up, if that's the right term. Anyway, after long interviews with both, helped by my children, who are in their 60s, George moved in July 19, and then come the COVID lockdown, my youngest son, who lives in Stockton-on-Tees, decided that I wouldn't obey the rules for shielding. He was quite right, and whisked me up to Stockton, where I had a marvelous 3 months, gardening, cycling all around the Tees Valley, and so on. Poor George was stuck alone in a strange flat while I was up north, because his boss wouldn't let him leave London and said he had to be available for work. Anyway, we survived that. I came back in July, and life has gone on. We live separate lives, which get mixed up a bit, and we quarrel, mainly about the washing up. George, you got something to say?
Yeah. No, for me, honestly, it has been amazing 2 years. Learning mostly from Norman, lots of stuff which you wouldn't get unless if you live with a British person, I would say, someone who has experienced all of those stuff. Sorry, we're facing now technical issues. 1 second.
No, just I think one of you needs to go mute. There you go.
My English has improved a lot since I moved in with Norman. I learned lots of words which I always say only Shakespeare would use, because Norman's English, as he worked as a publisher, is very, how do you say this?
Precise.
Neat English? Yes, precise, neat English. He has lots of vocabularies which I wouldn't have heard outside anywhere else. So yeah, I would say my English has improved a lot. He tells me lots of stories, nice stuff about the history, the culture. His family are very, very nice to me and very kind. And I always experience the British culture, family culture in the UK because of him and his family. So it has been magical 2 years.
Fantastic. Thanks very much for sharing some of your experiences. It's great to be hearing that, you know, how you've been there to support each other and to enjoy life and stay safe and well during the pandemic. So thank you. You're now sort of one of about 1,000 people who are involved in home share across the UK, which is now growing in the UK really rapidly. So I'm now going to move to Zoe and Jordan, who are involved in what for us is our newest model. It's been developed by the Australian Centre for Social Innovation over 10 years in Australia, and we'll be hearing from them later. But Zoe and Jordan, do you just want to tell us a little bit about Family by Family, which, as we said, connects two families together, and how do you think it can help people be connected to each other in this new world that we're all living in?
Hi, yeah. So basically, Family by Family is connecting people by helping other families who are going through a tough time, and they couple them up with a family that's been through a tough time, like ourselves. And we show them that, yeah, okay, it's tough now, it doesn't look good now, but things will eventually get better. We can promise you that. It looks really bad, but it's not. And then obviously we've got the thing where all the kids are involved as well, so it's a big family. It is like having a massive extended family. It's great because the kids are involved, they get to meet new people, we get to learn new things, they get to learn new things. And we have the group sessions on a Tuesday where all the sharing families come together and we hash out all the things that we're going through with our families, and we give each other a little bit of tips and everything. And it's literally, we've got Wendy and Kate and Becky, they're on the phone whenever we need them. And it is like a massive family, and we're just bringing each other together, and we're helping people who come from other countries as well, who don't know the area very well, and we get put with them and we show them where things are, or we give them support in certain things. So it's literally just bringing the community back together, helping people in tough times, and showing everybody that there is light at the end of the tunnel, sort of thing.
Fantastic. Thanks very much. And thanks for being part of what, as I say, in the UK is a pilot in Stoke-on-Trent with support from Department for Education and the council. But it's a model that we think has huge potential. We'd like to be able to roll that out in many more areas. So thanks very much for everything that you're doing. So we've got just a few minutes left, and I did want to just very briefly come to Debbie first, if we can, and just to talk about what do you think shared life carers need now in order to continue doing what you're doing. Do you have any thoughts on that, Debbie?
Quite a few. I think that daycare definitely needs to reopen for us. It's getting harder and harder to not feel abandoned. And if at the very least we knew why the barriers were still there to day services not restarting, that would be a starting point. Respite starting is really good, but it would be really nice to have the reassurance to know that we will be able to get respite when we need it. You know, I think it's in perhaps short supply, and you know, I think that would be really reassuring. And also we need support to secure an increase in payments. I know our scheme is something positive coming there. That's, you know.
Yeah, thank you. And those, yeah, really important points. And we've been doing lots of work with councils throughout the pandemic, and we've seen that lots of areas have ensured that people have started to get breaks. They've been working hard on day support, and we've had a long-standing campaign on pay and making sure that every council is reviewing its pay every year. We know that some of them, as you're saying, still aren't doing that, so there's still some work to do on that. And it's such an important point. We shouldn't be taking people like you for granted, who have absolutely gone above and beyond any kind of call of duty during the pandemic and done an incredible job. So I'm just going to finish by coming to May and Molly, who are both quite new to Shared Lives, as May became a Shared Life carer just a few months ago. So we'd like to hear about the assessment process and kind of how you were using a kind of a new assessment process. We've had support from government to develop that, but also just what's it been like taking your sort of first steps into Shared Lives.
Hello, I find that the Shared Lives process was really robust, which is reassuring that vulnerable people are safe. You know, the staff are always very lovely, very supportive, and made sure that, you know, Molly was going to be in a safe place. So I felt reassured by that. I feel proud to see Molly blooming. Every day is a win, and the positives are felt throughout the family. Recently, we've been to London, where we visited the Natural History Museum and we dined in the Ivy, so we're really going for it. It is possibly the most rewarding thing we've done together, and it's made us even more caring and complete as a unit. I feel all of us, including my teenager, will learn the fundamental life skills of kindness. But I think really it's Molly who should be saying how she feels about being somewhere new.
Yeah, I mean, like before I started the Shared Lives programme, I wouldn't have been able to have kind of talked on the Zoom meeting today. I mean, because I didn't really have the confidence or like have that kind of voice of my own to kind of be able to do that. And I've been living with Maze for, like you said, a few months now, and kind of in that time so far I've achieved, you know, working with the general public, learning to drive, learning to swim. We've gone abroad. I've got friends my own age now. I've been kind of making, you know, my own choices and challenging myself, and, you know, I've still got my sense of humour through it all, and kind of managing my own living space as well. And, you know, I've been able now to visit cafes and restaurants, you know, when it's been busier, and buying my own clothes, a little bike, and like having my own responsibilities as well, and doing my own washing and cleaning my space. And, you know, I've been learning how to cook and going food shopping, which has been kind of quite big for me, and starting to really enjoy life and realizing that actually I can achieve and be proud of myself. And like, I think most importantly really is that, you know, I've been able to start contributing to, like, you know, society, and, you know, they're all massive achievements that, you know, I wouldn't have been able to have made or done before I entered the programme. So yeah.
Fantastic. Wow, what a huge amount to have achieved in such a short space of time. And you were saying that sort of before you don't think you'd have been sort of confident enough to be on a call like this, but I know you do. You're here, and you're clearly got loads of confidence now. And I think you had a question that you wanted to ask Gillian Keegan, the Minister.
Yeah, I kind of hope that my experience can sort of influence sort of change in the way that, like, some disabilities are looked at. And I think that it's vital that everybody's given the opportunity and choice that I had. And, you know, someone's disability might be partially their environment, which was, you know, a bit of my, you know, well, a lot of my case. As with me, a change in my environment has allowed me to start living a much fuller life. And I think there must be others that would choose a more fulfilling lifestyle, given the opportunity that they're given their own voice. And I'd like to ask, you know, if Shared Lives could be offered to everyone over the age of 18 that receives, you know, services within the the health setting with, you know, social workers and social care, that it doesn't, you know, just kind of increase how much I've been able to contribute into the outside world, but, you know, it's really improved my self-esteem, and I think everyone kind of deserves that opportunity to have that choice to have a change and start living their life if, you know, some things might not be as it seems from the outside. And I think it's really good that, you know, I've been given this opportunity and that other people should be getting.
Yeah, so we can see, I can see you, Minister, and I think we'll be able to hear you. We may have your photo on the platform.
If I speak, sometimes that helps you pop up on everybody's screen. Can you see me?
Yes, you've just arrived on screen. Fantastic.
Okay.
Hi there.
Well, the great news is I've been able to see and hear all of you, so that's the most important thing. And actually, to Molly's question, I think, I mean, the reason I wanted to come on this call is to kind of learn from you, really, from the front line, what all these models are. They sound amazing. They sound, I mean, just a combination of things, really. I think the thing that's really struck me is how much everybody gets out of the model. It's really, you know, I was struck listening to Debbie and Pat and May and Molly, just how rewarding it is for everybody to see somebody blossoming, somebody blooming, somebody getting new experiences. And of course, the care and the company as well is so vital, actually. And I can only imagine, actually, during lockdown, in some cases, just how essential this was for everybody. There's a lot of people who were quite isolated during lockdown and probably would have loved to be part of this model, whether it's the home lives, the home share with that Norman and George are experiencing, and that I'm not sure if Norman's picked up a second language, but certainly George is really finding his introduction to the UK massively smoothed by that experience. But I guess also for Norman, it's been super stimulating and inspiring as well, and great company and learning lots and lots of new things. I'm very intrigued by the family by family. I mean, I am from a massive family, but not everybody is. And actually being part of a massive family, whilst there are some downsides, on the whole, there are many, many, many more upsides, particularly when there's times of trouble, because you've always got someone who's been through it, who can give you the sort of, yeah, I've been there, you know, this will get better, or this is how you can help things get better. That support is vital. And, you know, I've been very inspired, actually, going back to Molly's question, by the strength of this model. To me, it seems perfect. I could sign up actually for any one of these in the future. It's just something that I can see for most people is a massive win-win. Now, I was really interested as well to hear from May, because obviously the question everybody would ask is, how do you make sure it's robust? How do you make sure it's safe? How do you make sure that you trust people? It's the most trusting thing, like bringing somebody into your own home, and the most trusting thing for somebody to go into somebody else's care, you know, and that's something that, you know, I think it was really good to hear from May, actually, just how robust that was. So yeah, I'm super impressed, and the new experiences. I mean, listening to Molly, I mean, it just sounds ideal, and the whole family benefiting from some of the treats as well, like going to the Natural History Museum, going to the IB, but all the things that Molly's learned to do, which have made her more confident, all the things that Pat's learned to do, which have made her more confident and enjoy aspects of life. I just think it's a fantastic model. So it's been wonderful for me to hear about. I can't thank you enough. It's been lovely to let me come into your homes as well and hear all about your experiences. I guess one thing that would be also useful, because I think when you're looking in, you know, when you're a minister and you're looking at policy, is probably to hear some of the things that did go quite so well. Actually, Jeremy, that would be really useful as well, because there'll be all the things that people would question. But I can see the massive benefit. You know, in my family, I have many people who are foster carers, but this is just a different different models of trying to achieve aspects of the same thing, which is, when people have got a need, to be able to put people together and support what we all want, which is a caring friend, supporter, family, 2 families, extended families, and ultimately company and support to be able to be our best selves. So it's been, very inspiring. I've very much enjoyed it.
Well, thanks very much, and thanks for that warm response, and for listening into the stories from people involved in the 3 different models. And we of course, as at Shared Lives Plus, we're really keen to continue to work with you and your team about how we can offer these to many more people. And as you say, they don't always go well. We've heard there are brilliant stories, but also it can be challenging for people. And so our members have certainly got lots of ideas about how to make sure that the models work as well as they can, and that people get that kind of the right support and backup. And we heard about pay and breaks earlier as well, that allow those to continue to be what are the best performing models of regulated social care. So we'd love to continue that conversation and bring these to many more people. But thanks very much for joining us in your relatively new role, and we'll be all watching with great interest as the white paper on social care develops as well.
Yeah, no, thank you, and thank you for inviting me. And I definitely got the point about daycare, and I've already, in my less than 2 months, been to a daycare centre and said, I can see how vital they are, just all the support they offer, and they're much loved. And the one I went to, there was not many people back. And they kind of said to me, well, people are a bit uncomfortable coming back because of COVID, etc. But I also got the feeling that there was a little bit of a reluctance there as well, because, as we found out during the pandemic, it's much easier to close things down than open them up. And I think that's something, though, that we definitely get, because, I mean, that's the lifeline, right? That's the lifeline. That's the thing that makes these roles doable, particularly the shared lives model. They make them possible and mean that you've got the flexibility as well. Plus, the services you get in the daycare centres are fantastic. You've got loads of different facilities as well. So I have just spoken actually here and said, what can I do to I have done it, but what can I do more to encourage them all to get open to support the families and the people that need them so desperately.
That's going to be a really welcome message for our members, I know. So thanks very much. So thank you to the Minister. Huge thanks to all of our panel for sharing your stories. We could have listened to all of you for a lot longer. We've tried to pack a lot in, and we've hopefully kind of brought across just some of the richness of what you're doing, how important it is, as well as some of the challenges, and how much we all need to be working hard to make sure that you can continue to provide those roles in the future. So I'm going to be moving now on to a bit more about family by family, so which is the model that Zoe and Jordan were telling us a bit about earlier. So and we're going to be hearing from Vita Marano from the Australian Centre for Social Innovation, and our own Carly Attridge, who's been leading on the UK development of family by family. So Vita and Carly, over to you.
Thanks, Alex, and thanks everybody for sharing your stories and your experiences. And Zoe and Jordan, it was so heartening to hear your voices and how you explain family by family, because it still feels exactly the same as what we would hear a sharing family here in Australia talk to. Carly, I know we talked about me going first. Is that still okay?
Absolutely, go for it, Vita.
Awesome. So I won't go into explain the program, because I know Zoe and Jordan have done a fabulous job. Thank you. But what we've been doing is implementing the program here for over 10 years. And certainly 4 independent evaluations demonstrate that the program works. And you can see by Zoe and Jordan, it can work in a different country as well, which is fabulous news. But what we've really learnt from all those evaluations and working with over 1,000 families make change is that actually when you give families a chance to choose to engage in something, choose who to connect with, and choose what change they want to make, you can actually see some remarkable changes in themselves. And firstly, yes, it can lead to more resilient lives where families bounce back from difficulty quickly. And what we found really interesting is we've analysed over 1,500 change goals. So families coming into Family by Family choose a goal that they want to change and move towards, and a sharing family like Zoe and Jordan will walk alongside them to create that change. And changes that families are asking for is really around how do we get deeper and stronger family connections and relationships. How do we connect in with our community and reduce our social isolation? How do we increase our physical and mental health? How do we make sure we live in safe homes together? And also, how do we better understand formal and informal networks in our local neighbourhood? And what it leads to, and it does reflect a lot of what I've heard already about all your stories, is how do we create that human relationship again? Because actually what we're seeing is it's really hard. We've designed community connection out of life. And actually what we're hearing in the families here in Australia is they want to connect back. And actually this is one mechanism to do that. And the really remarkable thing that we love seeing is actually once families have gone through a change journey, you see confidence and you see hope. And suddenly families realise that they don't need to stay stuck in where they are, and they lift their sights towards something different, a more prosperous future, one where they're all thriving. And we see that both in seeking and sharing families. And, you know, what comes to mind more specifically is actually what I've been really fortunate to see in the space of 8 years. We've seen families break cycles of intergenerational disadvantage and unemployment simply by connecting with another family, having discussions with them, having someone understand them and not judge them, and suddenly have the confidence to make choices that are slightly different and lead to different outcomes for themselves and their children. That's really our biggest reflection. I don't want to take up too much time, so Carly, over to you.
Oh, lovely. Thank you, Vita. Yeah, it's so lovely to be here with you all this morning. And I actually wanted to share a story from a book by Boris Cyrulnik, who is a world-leading psychologist and is very interested in resilience and trauma. And what he describes is how the pearl inside the oyster might be the emblem of resilience. And when a grain of sand gets into an oyster and is so irritating, the oyster uses a substance, like an iridescent substance, as a defensive reaction, but what it produces is a material that is hard, shiny and precious, a pearl. And that really struck me in the context of Family by Family, because what I'm noticing on the ground in Stoke and how Zoe and Jordan shared with us so brilliantly is how that families want to turn their tough times into a shiny, beautiful pearl, and that actually that can help transform the lives of others. And what we're seeing is the importance of stories, being seen and heard, choice, and just being alongside each other who are having tough times is really powerful. So we've got 11 link-ups on the ground and 8 sharing families, so lots of connections that are happening in Stoke. And we really are seeing in quite a short amount of time how families are growing in confidence, they're trying new things, and they're a lot more happier and motivated to do things that are right for their families. And I suppose that I'm starting to see all of our families as pearls, and that maybe if we can continue to support families to be able to come alongside each other in ways that they want to do, that is their choice, that perhaps we can help people to turn all of their tough times into pearls. Thank you.
Thanks very much, Vita and Carly. It's really beautifully put, and I think this theme of that connection and learning from people's real experiences, including the tough times, is really coming through as a theme for the event. And it's part of, I think, that message about diversity and how we need lots of different perspectives and experiences if we're going to have more creative ideas and avoid that groupthink that Mike was talking about. So thanks very much for introducing us to the model. We are, as we said, really keen to expand Family by Family. in the way that we've been able to help home share grow and to bring shared lives to be almost completely UK wide now, with exciting work going on in places as far flung as the Isle of Wight and Shetland to fill in some of the gaps. We have some time now for some questions, either on family by family or to our panel. We don't have the Minister still with us, so we won't be able to put questions right now to the Minister. But Phoebe, who is here in the background, beavering away at the chat and looking at the questions on the platform, is going to be highlighting some of those for me. So Phoebe, I can see we've got a question about innovation in day centres from Sasha in Greenwich. Let's come back to that theme of daytime support. I guess this is probably one for our Shared Lives colleagues in particular. What really helps you to make your Shared Lives role work really well for people and for yourselves, and keeps that sustainable for yourselves, particularly during a tough time? And also, how do you ask for help in your role when it's hard? And that's from Denny in Camden. So I don't know if anybody on the panel would like to talk about either of those things, about asking about the help you need when it's hard in Shared Lives, or about that kind of the things that work really well for you in terms of day support. If you wave at me, I will be able to see. It looks like Manjeet, I think you wanted to talk.
The thing was that we had a lot of problems with Pia, especially being with the panel. When we go through the panel will just think about just the paperwork, what they read, but they do not realize what the individual is, or they've never seen the person. And the costing is very worried about that. But the thing was that we were waiting to go to the center, and the panel went through and they gave us 1 day. So we had to wait and argue and send Zoe Williams, the social worker, to the panel 4-5 times to extend the time that she can go in and give us 4 days, what was ideal for her. But
to get the right level of support there.
That's right. And eventually we won. But the thing is, the panel has to realize what the person's needs are, rather than just looking at the paperwork and looking at the costing, how much it's going to cost.
And I think that information sharing comes up a lot, and that's often the start to a really successful Shared Lives arrangement, or it can be the start of problems where that information sharing hasn't been good enough. So that feels like a really important point that we hear from members a lot. Adrina and Joanna, I wondered if you had any thoughts on this, or that question about, what would your advice be to Shared Life carers when they do need some help when you're facing particular challenges? And there's also a question here about connecting Shared Life carers locally as well, which I know is something that people can feel isolated in their roles, and that can be really important. Do you have anything you wanted to share on those?
So in our circumstance, obviously, as we've said, our coordinators were really helpful, and they're just always there, so it's easy to just get in contact with them. So our main advice, I'd say, would just get in contact, and don't hold back if you do need help or support. That's what the staff are there for, so make the most of it. And even if you don't really know what to say, just reach out, say anything. It's important as well. Like for carers, you have to look after your own mental health as well. And that's a big thing, because you can't look after someone else if you're not looking after yourself. So it's very important to ask for help when you need it.
Yeah, fantastic. Thank you.
Yeah, that's fine.
Yeah, they're brilliant. Well, that's really well made points. Thank you. And there's a question that's come through about when when shared life carers do want to change things like respite or breaks or pay, how can they organise locally, and do any of the panel have any experience of working as a group with your scheme and those kinds of negotiations and getting good results from working together as a group? I don't know if any of those who haven't spoken yet, I don't if you want to come in on any of those, or if one of the other panel has something to share on working as a group locally. Debbie and Pat, do you want to?
Yes, we've just heard recently that our scheme is going to endeavour to get some champion groups together. We had a discussion about this yesterday, and that was, very hopeful. So, we're just really hopeful that does happen, because I think carer to carer support is absolutely invaluable. Be really lovely to see to see more of that. Yes,
that's really good to hear. And Lynn, our colleague who leads our membership support, and her team have done lots of work. We have our carer champions who are shared life carers themselves, who have done lots of work working with local groups. We've always found that the strongest shared life schemes are those where there is a local group and they've been able to develop a really positive relationship with the shared lives schemes team, and often also talking with people like local councillors and others in the area as well. And we have a charter which is helps people to set out and as in their local area what their expectations are on both sides. We've also got something called the Ambassadors Test, which was developed by some of our Shared Lives ambassadors, who are people with lived experience of using the service. And again, that helps local areas think about what does good look like from the perspective of people using the service. So there's lots of support and resources there. And our dream is that we'll have a local group in each area and that they'll be really well connected and working together, because we are all working for the same thing. May, did you want to come in on this one?
Yes. I live in the southwest. They have sort of regular sort of green tea groups that me and Molly can go to, and they do have carer coffee morning. So I've known right through from the beginning of going through the process that there would be other supports. I've been connected with a couple of the carers that live in the local area, and they've rang me up and introduced themselves to me and said, if you need any help or you want to talk, just give us a shout. So I felt really very well supported from the get-go, really. And there being that sense of community, and that there's lots of people around here that are also doing the same thing, and having these little sort of coffee mornings and green tea days are just ways of kind of connecting us all in a positive environment. So I've experienced how important it is to have these this connection.
Sorry, I was just on mute there. That's the first inadvertent muting of the event. I'm sure there'll be a few more, but thanks very much for sharing those thoughts. And Norman, I was just wondering if I could ask you if you're still able to come off mute for us. I was just interested in what your advice would be to other older people who might be thinking about something like home share but be a bit nervous of it. And I can see you may be struggling to come off mute, so I can come back to you if your IT support isn't there with you right now. So I'll come back to you, Norman. Zoe and Jordan. We heard sort of about you, a bit about your kind of experiences of family by family as you're starting to get to grips with the model. Has it been sort of what you expected? Have there been any surprises? And again, what would your advice be to to other families who might be thinking about getting involved, but perhaps not have heard of something like that and be a bit nervous about it?
I think I'll let Jordan take out on this one. He's better at these things than I am.
Yeah, I mean, family by family as a whole, I mean, what I've always said is one of the worst feelings a person can have is watching someone struggle and being unable to do anything about it. Family by family has opened up a once closed door to not only families seeking help, but also families who want to help others. And what family by family has done for me mentally and emotionally, I can't thank them enough, honestly. I mean, there is something that they call helpers high. Helping others releases endorphins, which in turn improves mood and boosts self-esteem. And that's what I think it's done for me and Zoe. So in short, I mean, helping others, it just feels good. The person or the persons who are providing the support to the others, it can activate like a neural pathway in the brain that boosts our well-being, which of course then boosts the well-being of the seeking family, creating a circle of positivity. We just want to show people it's okay not to be okay.
Yeah.
I think the primary thing of it is how welcoming our seeking family has been. They have been so totally open to every suggestion we've thrown out there. They've literally taken all advice on board, and they're just an amazing family to work with. And everybody else has said the same. All their families have been so good to work with. It's just so rewarding.
Fantastic, thank you. It's really beautifully put. So thank you to you both. I think that really, and we hear that, I think, from people participating in all of the different models, that it can be difficult, there can be challenges, but actually the rewards can be amazing for everybody involved. And I think that kind of virtuous circle you were talking about. Sorry, Zoe, go on.
I said the rewards outweigh any struggles tenfold over.
Yes, I think I've come off mute.
Hello, Norman, you have. Well done. Yes, so I was just interested in what your thoughts might be and what any message you might have for other people who might be thinking about that they might benefit from home share, but perhaps be a bit nervous about the idea because it's quite a new idea for lots of people.
Well, it's quite an expensive idea. Poor George, who has a minimal income, is charged £200 a month in perpetuity, and I get charged 45 quid. Well, that's a disbalance. And we don't know anybody else who's done it, but I would recommend it or something similar to try for other people in my situation or who'd like company. George and I live our individual lives, and this, I think, works. We also do things together. Fly kites, go to the theatre. He'd never been to the theatre in Syria.
So that was completely new for him.
Yes. Well, yeah. He came to England on a Foreign Office scholarship, did a master's degree in English, and this worked. This is why his English is so good, because everybody had a go at Englishing his master's thesis, including me. And he didn't like the hall of residence he was in, which was expensive, and found this opportunity. And with the help of my children in interviewing, because I'm a lousy interviewer, we found that we clicked.
Fantastic. And I think on that point about affordability, that's something that's a real goal for us as well, because as you say, at the moment, home share is only available to those people who can fund it themselves. And often for the young person, it's a real saving on rent. But we'd like to find ways to make it more affordable for everybody, including people who are on low income. So I think that's a really important point. We are just coming to the end of our session, and I'm seeing that from in my little chat box here from Phoebe that there's there's quite a lot of kind of questions which are along the lines of what got you involved, what sort of brought you, whether it was home share, shared lives, or family by family. What is it that kind of that motivated you to get involved, or that you were looking for? I don't know if anyone's got any thoughts on that, or just wants to share kind of, what gets people excited about these models and want to take part.
I think for us, being with Family by Family is because obviously we suffered mental health issues between the two of us. This one's bipolar, I've got ADHD and complex PTSD, and things just took a terrible turn about 3 years ago, and it was bad. And then I got into the system, got all the help that we needed, and then we kind of came through it, and then COVID hit us, and we both sat there and were like, look, our passion is to help other people and show other people that it's crap right now. It's going to be good. We're not just going to go in there and say, right, this is what you've got to do it now. No, we'll go in there and say, what do you need from us? What can we do for you to help you? And that is the best thing about Family by Family. Our Seeking Family tells us what they need, not us telling them what they need to do. Like a social worker would go in and say, this has got to be done by this time. We go, no, okay, I'll listen. You tell me, I'll help you work towards your goal. And that is probably the best thing about Family by Family. It's no pressure. It is, you're my family, let me help you. And away
Fantastic.
We go.
Thank you. That's such a powerful message, I think. And the again, something I think we hear from lots of people that it actually, which across those models, it's that ability just to not be on somebody else's schedule and not come in with your own agenda, to think first and foremost about how we're going to get to know each other, how are we going to form a relationship. And actually, as we've seen, and we heard that from Molly's story earlier, that you can achieve incredible things at sort of such a fast and an amazing amount of change. But actually, it's from that approach of not having somebody trying to make that change happen for you, but just allowing you to be yourself. So thanks very much. That feels like a really great point to bring our panel to a close, as we are just about to hit our first coffee break, if I've got my schedule right. So thank you so much to everybody on the panel. So we've got first workshops are going to be starting at 11:30. So you've got 15 minutes comfort break, and there will be no queue at the coffee bar, and unless you've got a very busy house. So enjoy your break. Thanks very much. I hope everybody's found this morning's session really interesting and stimulating and inspiring. I know I have. And we will see you back in your workshops, which you can access through the platform. So you've got a link on the left-hand side of the platform. You should have your workshop that you've chosen already up there, and that will take you through to lunch at 12:30. During lunchtime, there is a mindfulness session as well, if you want to take part in that. And then this afternoon, we've got our public webinar, which is about building resilience and community connections. That's for delegates here, but also we've got people coming from all over to that session. And we have our AGM, where you'll be able to hear more about what we're doing, what we're planning, what we've done, and the things you've been asking us to do during the year. So do please join us for that as well. That's going to be just after 3 p.m. So I'll let everybody get to their break, and thanks again to our amazing panel and to everybody involved for everything you're doing.